Namaste everyone. In today's video, we are going to talk about kidney failure. What are the types of kidney failure and what is the difference between different types of kidney failure. Now, kidney failure by definition means kidneys are not working, kidney function is not up to date. Now, there are two types of kidney failure. One is called as acute kidney failure and second is called as chronic kidney failure or chronic kidney disease. Now let us see what is the difference between these two types of kidney failure. Now if you see acute kidney failure, this is something which in which the kidney stops functioning abruptly within few hours or few probably days. Whereas in chronic kidney disease, the kidney function or kidney failure happens over a period of months to years. So acute is uh, something that happens abruptly, suddenly within few hours or days. Whereas chronic kidney failure, it happens over a few months to few years. Now let us discuss what is acute kidney injury or acute kidney failure. Now acute kidney failure by definition is if there is a rise in your serum creatinine. Serum creatinine, remember, is a marker for your kidney function. Whenever there is a rise in serum creatinine by 0.3 milligram per deciliter in 2 days, 48 hours, or if the creatinine goes up by 1.5 times from the baseline, that is something called as acute kidney failure. Now, let us see what are the causes for acute kidney failure. Traditionally, the causes of acute kidney failure are divided into three groups. One is pre-renal, second is renal, and third is post-renal. Now, pre-renal are usually due to dehydration, severe dehydration, gastroenteritis, bleeding or hemorrhage, excessive use of diuretic pills, burns, various types of shocks like cardiogenic shock or septic shock. It can also happen in cases of heart failure. It can also happen in cases if someone is taking a bigger dose of antihypertensive medicines or some sort of painkiller medicine for longer duration. The renal cause or intrinsic renal cause are usually due to a tubular injury or a renal vessels disease or sometimes interstitial and glomerulonephritis. Interstitial disease and glomerulonephritis. Now, tubular injury is usually due to prolonged ischemia, some sort of nephrotoxic medicines, hypotension or sepsis. Vascular disease can be due to thrombosis of blood vessels or hemolytic uremic syndrome. The interstitial diseases are usually due to interstitial nephritis or interstitial infection. And then there are glomerulonephritis, where there is a post-infectious glomerulonephritis or a rapidly progressive glomerulonephritis that can cause acute kidney injury. Now, the post-renal causes for acute kidney injuries are usually due to obstruction in the urinary tract. Now remember, for obstruction in urinary tract to cause a renal failure, there has to be either obstruction which is lower down in the tract or it has to be bilateral. So it can happen if someone has a bilateral kidney stone which is blocking both the tract. It can also happen if there is obstruction lower down, either it can be due to a prostate obstruction or urethral stricture or urethral obstruction due to some reason, or something in the bladder which is causing blockage of both sides of urinary tract. Now let us see what are the causes and stages of chronic kidney disease. Now, chronic kidney disease is usually a kidney disease or a kidney failure over months to years. Now there are 5 stages of chronic kidney disease. Whenever it all depends on what is the GFR or glomerular filtration rate. In simple language, it's the percentage of kidney that is working. Now it's divided into 1, 2, 3, 4, 5. Now 1 is when the GFR is more than 90. It's stage 2 when the GFR is between 60 to 90. It's stage 3 when the GFR is between 30 to 59, stage 4 when it is 15 to 29, and stage 5 or end stage kidney disease is when the GFR is less than 15 ml per minute. Now, the common causes for chronic kidney disease all over the world are: number 1 is diabetes, number 2 is hypertension. Uh, these are the common contributing to almost 50% of the cases of chronic kidney disease. In addition, the other causes for chronic kidney disease are chronic glomerulonephritis, chronic tubulointerstitial disease, obstructive nephropathy, and almost 20% of the cases the etiology is not identified. There is definitely something happened, but somehow the disease is identified at a very late stage. So in almost 20% of the cases it's unknown etiology, what we call it as idiopathic. In this video, we have seen the types of kidney failure, acute and chronic, their definitions, their stages, their causes. In subsequent videos, we will see about each of these diseases in detail. Thank you.